Hi everyone, today we will discuss allergy and hypersensitivity. In our daily life, we are exposed to certain substances like pollens, dust, and certain chemicals, but most of the time, our immune system is strong enough to protect us from that substances. But sometimes, our immune system reacts excessively and produce a most exaggerated immune response known as allergy or hypersensitivity. So basically, allergic reactions may range from mild rashes to life-threatening anaphylactic shock. So first of all, we should know what is allergy, its causes, its mechanism, its major types, and its diagnosis, and ultimately the management of allergy. Now, moving towards what is allergy. Allergy is defined as a specific hypersensitivity of an individual to a foreign substance, usually a protein to which individual has been previously exposed. It is an inflammatory reaction which is consequences of immunological process. So the agents which cause allergy are known as allergens. These are antigenic substances capable of sensitizing the body in such a way that unusual responses occur in the hypersensitive individuals. Almost any substance, whether of biological or synthetic origin, may prove to be allergen. There are many types. They may be contact allergens, ingestant allergens, infectant allergens, or inhalant allergens like pollen grains. Now, moving towards the cause of allergy, according to various studies, the tendency to develop an allergy is hereditary. Like, there are also many factors like emotional factors, atmospheric factors, psychosomatic factors, chronic type of infections that may cause allergy. But still, the exact cause of allergy is still undetermined. According to hereditary, if the both parents are allergic, then there is 75% chances that the offspring will also get allergy. And if the one parent is allergic, then there is 50% chances that the offspring will get allergy. Now, moving towards the type of allergic reactions, there are four major types. Type 1, which is also known as anaphylaxis, type 2, which is also known as cytotoxic, type 3 is also called as immune complex. Now, what is type 1? Type 1 is also known as anaphylaxis. It is mediated by IgE antibodies, which are produced when an allergen binds to the surface of mast cells. On secondary exposure, the antigen antibody reaction takes place, which triggers the release of anaphylactic mediators like histamine and leukotrienes, which produce three major effects like contraction of certain smooth muscles, relaxation of blood vessels, or increased permeability of capillary walls. Now, what is type 2? It is mediated by IgG and IgM. When an allergen binds to the surface of blood vessels on secondary exposure, they produce many effects which lead to cellular destructions like hemolytic anemia or thrombocytopenia. The type 3 is also known as immune complex. It is mediated by IgE antibodies. When the allergen binds to the blood vessels on secondary exposure, the antigen antibody complex formed, which causes precipitation of tissues, resulting in inflammation of organelles like alveoli or kidney. Now, what is type 4? Hypersensitivity. It is not mediated by antibodies, it is basically mediated by sensitized T lymphocytes and macrophages, which cause phagocytosis. And upon re-exposure to allergens, T lymphocyte release lymphokinins, which are the specific type of cytokines released by lymphocyte that mediate immune responses. In response to that, they trigger a series of inflammatory reactions resulting in development of allergic contact dermatitis or pneumonitis in lungs. Like in dermatitis, there may be formation of wheal or eczema, or pneumonitis, as we know, it is the inflammation of alveoli in lungs that cause serious problems. It is not immediate, it occurs within days or weeks or even months. Like here is the graphical representation. When allergens on primary exposure to the blood, they form T lymphocyte or macrophages, while upon secondary exposure, they form lymphokines, which trigger a series of responses which may affect skin or lungs. Like in skin, it may cause dermatitis, or in lungs, it may cause pneumonitis. Now, there are two mechanisms on which the four type of hypersensitivity work. First one is antigen antibody mechanism, and second one is delayed mediated cellular allergic mechanism. It is for the delayed type of allergy, while the first one is for type 1, type 2, and type 3 of hypersensitivity. In the first type of mechanism, the antigen antibody process, allergens act as antigens, prompting antibody production that may circulate or attach to the tissue cells. Initial exposure typically causes no symptoms, but subsequent encounter trigger antigen antibody binding, releasing mediators like histamine or leukotrienes. These substances cause effects such as bronchoconstriction, vasodilation, low blood pressure, capillary leakage, hemolytic anemia, or dermatitis. Like hemolytic anemia, our own body cells, antibodies cause destruction of red blood cells. Now, moving toward the second mechanism, which is cellular mediated allergic mechanism. Allergens, which are often called as haptens, bind to the body proteins. They form complete antigens. Then these antigens are carried by Langerhans cells, which is a specific type of antigen-presenting cells, to the lymphatic system. Then the lymphocytes and lymphatic system become activated and multiply and become lymphoblasts. These lymphoblasts differentiate into two cell types, memory cells or stimulating cells. Memory cells store antigen information while stimulating cells react upon re-exposure. Now this re-exposure to the allergen triggers stimulating cells to release lymphokines. These lymphokines cause allergic symptoms like contact dermatitis, as this mechanism is for delayed type of hypersensitivity. So its onset time is 6 to 25 days after initial exposure. Now, these are major allergies related to type 1 immediate hypersensitivity. Common allergies are allergic rhinitis, which is runny nose, hay fever, nasal allergies. Allergic asthma, there is airway constriction or atopic dermatitis, which is eczema, or food allergy, which is also IgE mediated reaction, like to certain shellfish or fishes, or drug allergy, like to the drug like penicillin, it is also IgE mediated, and severe reaction like anaphylaxis, which is a severe life-threatening systemic reaction to the allergens, which may cause death in severe cases. These are the most common type of allergies found in our environment. So they are related to immediate hypersensitivity. The reaction occur within seconds or minutes. Now moving towards the type 2, which is cytotoxics. The autoimmune hemolytic anemia carries under the shadow of cytotoxic, like the antibodies destroys body's own red blood cells or some drug reactions. In type 3, there may be serum sickness. There may be serum sickness like antigen antibody complexes deposit in tissues causing inflammation. There may be lupus nephritis or type 4, which may cause allergic contact dermatitis or celiac disease. In the type 4, the T cells react and cause immune responses, like in allergic contact dermatitis. They may be responsive to delayed rash, or in celiac diseases, they may mount an immune response to dietary gluten. Now, there may be certain skin tests for diagnosis of allergy, like there may be scratch test, intradermal test, or patch test. The scratch test is similar to the smallpox vaccination. The body is scratched and the extract of allergic substances is inserted. Now, after 20 to 30 minutes, a veil is formed. If its diameter is greater than 0.5 centimeter, then it is positive. And in intradermal test, we only inject a small quantity of extract intradermally, and if the allergic reactions occur, then it is positive. And in the patch test, there is no need of needle or scratching. We only apply an adhesive patch on the back of the person, which contains certain allergens, and now they are observed for certain days, like often 48 hours after the application, or again after 2 to 3 days, which may tell us that if the patient is allergic to certain allergens or not. Now, there are also certain blood tests for the diagnosis, in which a sample is analyzed for in laboratory to detect multiple allergens at once by measuring the concentration of specific IgE antibodies. Common allergy tests are radioallergosorbent test or fluorescent assay, immunoassay. And the fourth test is challenge test. This method is commonly used for food and drug allergies, where the suspected allergens is eliminated for the set period and then reintroduced to see if the symptoms occur. And if the symptoms are occurred, then the patient is still allergic to that particular allergen or food or drug. As we know, allergy is not treated, we can only manage it by different ways. The first way is immunotherapy, in which allergen immunotherapy involves repeated administration of specific allergens to patients with IgE-mediated allergies to reduce symptoms and inflammation. It starts with low doses of individualized allergen extracts given once or twice daily, with the gradual dose increases over months to years. This leads to immune tolerance, allowing higher doses and reduced symptoms and medication needs. After reaching the maintenance dose, injections are spaced every 1 to 6 weeks. Now, the second one is drug therapy, in which certain tests like antihistaminic drugs are used to alleviate the symptoms of allergy, but they do not stop the antigen antibody reaction. Now, the changing environment, if the person is allergic to specific environment, we will just change the environment. But in food elimination test, we eliminate the food to which a person is particularly allergic. So these are the